Rich, do you know Andy Gardner? Andy Gardner? He's the Olivia Hills mayor, but he happens to be a lawyer too.
Yeah,
Alright, well anyhow, so he posted on Facebook a picture of a skeleton. On the side it says Andy Gardner. I mean, it was pretty good. I was like, okay, I wonder what that, who's white.
actually, I just saw him somewhere about a month ago.
Yeah,
Yeah, at a fundraiser.
he's a nice guy.
Just don't put camera coming.
Okay.
Yeah, 2 minutes.
Yeah, training with this.
Dr. Cameron coming?
Oh, Dr.
I don't know.
Cameron.
I don't know if you
He
responded
was
just
in the
now.
office yesterday, but I don't know.
Oh, 1 minute.
Should I text him?
You can. For some reason my team's not coming up when I realize.
Oops, sorry.
So there was a newsy guy, he was in the England area, he was doing his show.
Oh my.
Live? Yes.
There he is.
Oh,
Man of the hour.
hey.
We were gonna clap as you came in.
I'm sorry.
Caught us off guard.
I've had enough of that all day.
Wow, that's all we don't know.
Alright, you like to call us to order, sir?
Okay. Good evening, everybody. Welcome to October Geauga Public Health meeting. Please stand for the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. So did everyone have a chance to review the minutes from the prior meeting? Any comments?
I do, of course.
Go ahead.
Which priority?
So from the
First,
There's three of
September
them.
9th, 26th, and October 6th.
for September 9th,
Uh-huh.
the emergency meeting, it says the regular Board of Health meeting will be Wednesday, September 26th, and it was Monday, September 26th.
Okay.
And
That's probably, yeah, we can change that. That would have been, cause that'd been what it was at the time before we moved it.
No, it's not. I mean, it's,
Oh,
the
it
date
just
is
says-
right.
okay, yeah,
It's-
the day.
it's just the day of the
I
week is
gotcha.
wrong.
I'm like, look at my calendar, it's Monday's the
Yeah,
26th.
so it should've
Yeah,
been Monday.
so we did that to Monday.
Okay.
and then on September 26th, there's just a typo under other business. She would like to review the changes at the full board versus as full board, that's all.
Okay.
I can pass you this if you want.
Yeah, and Alta is listening in, so she's gonna make changes as we
Okay.
talk about it.
It's just a typo.
Okay, yeah, we can change that too.
Okay.
Anything else? You got it?
Yep,
Okay, so, move to approve the minutes for the September 9, 2022 emergency meeting of the Board of Health. Do we have a motion?
So moved.
Okay, we have a motion. Do we have a second?
Second.
Okay, all in favor?
Yes.
Aye.
abstentions?
Any,
abstain.
Yeah.
okay, any abstention? Okay. Any opposed? Okay, well, that's good. So the next one is move to approve the minutes for the September 26, 2022 regular meeting of the Board of Health. Do we have a motion?
So moved.
Okay, do we have a second?
Second.
Okay, any discussion?
No.
All in favor?
Aye.
Any opposed? Okay. Then the next one, excuse me, is move to approve the minutes for the October 6, 2022 emergency meeting of the Board of Health. Do we have a motion?
So moved.
Do we have a second?
Second.
Okay, all in favor?
Aye.
Any opposed?
Abstain.
And abstention, one abstain. Okay, thank you for that. So the next thing is the information session. So we can start with Environmental Health Division update, Mr. Lark.
Good evening.
Good evening.
No more updates really versus what's on the report. So we're looking at starting to do some planning for O&M stuff, getting the computer program that we have for inspections up and running also for the food staff, but that's all I have to add today. If there's any questions?
Nope.
Any questions from Mr.
I thought it was
Lark?
interesting that two people that, I mean, the two organizations paid their license fee.
Yes.
Yeah. I did stop by those locations after you guys voted to forward it on and just said, just to let you know this is what's gonna happen later today. And they actually called me before I got back to the office.
Good.
It's amazing how
Thank
it
you for
works.
taking that action.
I noticed that,
Good to hear. Okay, so the next thing is Population Health Division update, Mr. Engineer.
Only a couple updates. Melissa Kimbrough, our new RN, we were fortunate we got her as quickly as we did, and
Wow.
she onboarded, we got her from across the street. So,
Across the street, the hospital?
from UH.
Okay.
So, she's working out really well. She's completed about a full week. She started midweek last week, so that's going well. I also, made a job offer today for a health educator, and she accepted. She will not start for like 4 weeks out. She's actually an SIT. But she wants out of SIT.
Ooh.
She has a degree in public health, so she really wants education. Taking her from Stark County. She's coming up from Stark County, so we'll have that,
She wrote the same thing to me. She goes, she's an SIT. I go, perfect. She doesn't want to do it.
No.
I was like, I was
She
telling
made it
you.
very clear in the interview, and I said, okay, that was one premise, because she did get her bachelor's in public health, and that's really the direction she wants to move in, so.
And she's gonna drive from Stark County up here?
She's actually gonna relocate. She has a sister that lives not too far from here, so that's the plan for now, but we're gonna onboard her in like 4 weeks, so more information to come later, but
That's
she's
exciting.
experienced, so that'll be nice. Should be easy transition.
That
What
sounds
is the
great.
background on the RN?
The RN, she actually works at Richmond Hospital. She worked med surg for 4 years at Richmond. When they closed Richmond down, she went to Geauga med surg, and we got her here, so. And she's a Chardon resident, so she lives like 7 miles from here.
Wow.
Yeah.
So,
That's
and
a
loves
great
the
find.
schedule, so, and
Great.
eager to learn. So far, I mean, it's only been a week, but.
Good attitude though, so far.
Yes, she's a very positive
Very nice.
person, so it's nice.
Okay, good for you, Carol,
Yes, I'm
thank you.
excited. I was not expecting that news.
Yeah,
Yeah.
that was quick.
So, any questions? That's my updates.
So I do have a question, okay, on the news a lot, it seems like, okay, there's influenza, there's COVID, and there's this, what is it, RSV?
RSV, respiratory syncytial virus.
Yeah, so what, do we know anything about that currently, or they say it's,
No, you know, they would like to talk about viruses a lot, but the RSV doesn't seem to be any different than, it has ebbs and flows, you know, and the fall it tends to peak. There's a lot in the Amish community. The flu season is the flu season. If you haven't gotten your flu shots, you should, okay? And then there's this COVID thing that's still hanging around, okay, which is not the same virus as 2 years ago, okay, it's a different virus. But it can be severe for some people, and some people are getting shots, and a lot of people aren't. And some people are recommending children get shots, but not a lot of kids are, and that's probably a good thing.
And that is something that we're not carrying. We do carry vaccine because it starts at age 12 and up. It's the same vaccine as for adults, starting at age 12 and up. So obviously, we could immunize like a 12-year-old. We
But
do
not
not
for
have that
five.
demand.
The
I do
people-
not
yeah.
carry it for young children. We have not, we've wasted doses. It's not something that we're carrying.
And
that we're even
we had
offering.
someone actually just request one for a 6-month-old, and we said that's not,
He's called everywhere and no one's carrying it because there just isn't a demand for it. I mean, people are not immunizing their 6-month-olds for COVID. So, but, we only see adults. We haven't really even immunized teenagers. People just are not coming to us for that.
it's mostly what you'd expect. Like today, we had quite a few people come in, and that average age was probably in the 70 to 80 area. I mean, that was,
And higher.
it's who you'd expect to use the flu
Makes
shot
sense,
too,
right.
it's the people who are high risk. I mean, that's every I saw today.
Dr. Rue, do you have any comments or no?
What makes RSV difficult this year is that it's a triple threat, because it's not just RSV, which has its own unique characteristics, but it's RSV at the time of flu, which is coming a little bit early, and still we have COVID. So it's overwhelming some hospital systems, especially the pediatric
Gotcha.
hospitals.
It's good to know.
Yeah, because I think I heard 2 or 3 or 4 kids a day are going into the hospital because of that or something, if I heard that correctly.
We're definitely seeing an increase in RSV visits.
At
Most of,
UH or
yeah, most of them, and when I say most of them, the number is still small, but this is definitely the time of year where those numbers increase and it's significant enough to notice. But most of those kids, do well and go home. There have been a few that are very, very severe cases, but it's, just important, the normal protocols for making sure, you keep your distance. Again, you always see the post, don't kiss babies, things like that, but
There was a movement to get 4 beds for peds in the hospital. Are those being used, or is everybody just, if they need to be in the hospital, they can ship down to?
So, I don't want to speak on behalf of the hospital by any means,
No,
but what I
I
can
think-
tell you is we do see pediatrics in the emergency department. There is, they do provide limited pediatric care on one of our med-surg units, as well as in the OR area. They can see pediatrics, but it's a very specific population.
Okay, so they're basically getting transferred.
Yes, if there's severe pediatric patients, they're getting transferred, but I would follow up with them to see if there is any expansion with those beds.
Just wondered if things had changed.
Probably not from the
No.
last time,
They
yeah.
Okay, so, Alta, can you hear us? Does she want to go?
She can't speak through, no.
Okay, so administration division update?
Yeah, scroll to that. And just so everybody knows, I've got behind everybody, just the update from everybody, so that's why, so the population can see. You all have yours in front of you, but this is just, yeah, so I mean, she has the permits that are processed and whatnot, which is not too far off the regular time. And then the administrative hearings was kind of the big thing that came up. Was Dan and I talked about this as well. We had 3 people who were planning to be here tonight. I don't see them here. They were frustrated that 2020, I think, was all of them talking to Evan. They called in to get a FSOP inspection, for sale property inspection, and it was probably during when sanitators were doing contact tracing, and they either heard or they inferred or they were told that we weren't doing inspections right now due to COVID. They took that as they don't have an inspection, I guess. So they didn't have one done. So they get a letter from the court saying, you screwed up, which then they're not happy, so they came in. We're working with them the best we can, but as we said last time, it's equal application of the law. So, did we take one on the chin? Absolutely. We should have followed up with that. But nonetheless, we still have to equally apply the law. So we're trying to work with them the best we can. The administrative hearing is the first part of that, the first step. The goal is never taken to the prosecutor. I mean, that's not, no one said, I can't wait to the prosecutor's office with so many people. The goal is how do we get your house in compliance, how do we make sure you're not polluting, and move on from there. But there's frustration that comes with that.
You know what, I can attest that was true during the initial stages when COVID first hit. This department canceled all those for sale.
Yeah, I mean, and there's the
But it
whole.
was only for a few months.
Yeah, I mean, the whole health department was doing contact tracing, the whole health department was doing like some of the
Right.
clinics, they
Right.
were, there was the concern, like, when COVID first came out, and I've talked to most of you about, I mean, there was, concern like, I remember one of the conversations was look to your left, look to your right. One of those people's probably not gonna be here in a year from now. I mean, that was just crazy high death rate they were assuming. So people pulled back from stuff and said, hey, let's realign and reassess, and that could have been that time. I mean, you know, I'm not saying I know that for a fact, but
Right.
I do understand where the person's coming, the three of them are coming from. We're working with them the best we can. So if they come into a board meeting, they'll obviously explain to you the situation they're in, but Dan and the team's gonna work the best we can to just process them, get the inspection done and get them out, and hopefully avoid the prosecutor involvement.
You know what, it's funny too, I did get a question from was actually an installer. He said he heard that, for sale of property inspections we're not going to follow through for the for sale of properties prior to June 30th.
I think I responded to that person in an email, actually.
You did?
I believe I got the email.
And
from
so,
them.
but as far as this department's concerned, we are still gonna require those inspections.
Yes.
We actually have to, according to the prosecutor, it's not even.
Correct.
Even if Dan and I said, hey, we don't wanna do it, I mean, at that point, we'd be going against legal recommendations, which is a really bad idea, in my opinion. I mean, I follow the process, why, you know, that's why we have them, right? That's why lawyers know the law.
Right.
So,
I just wanna make sure we're on
An
record.
opinion from the prosecutor's office citing what law they're relying on for that opinion?
I'm trying to think what that email said, but I think she cited equal application of law.
But I don't know what that is. I mean, I know what the Fourth Amendment is, but that's not the Fourth Amendment.
And we can ask them to cite specific.
Yeah.
I'm talking about the ORC, but.
Oh, yeah, no, yeah, I get where Carolyn's going. We can ask, Dan, can you ask Linda that? Just go back to that email and send it back to her. Yeah, we can
Yeah,
ask.
I would just
for it.
like more of an analysis rather than just the conclusion.
Mhm. Yeah, we can ask for that.
Okay.
Yeah, so that's it for all. I mean, everybody else read the rest of it, so I'm not gonna go too crazy into detail on that.
Okay, thank you for that. How about your update, Mr. Administrator?
You wanna do finance first?
Uh,
Finance should be underneath there, or is it underneath me now?
That's
Sorry,
under
underneath me
you.
now. Okay, sorry. So for my stuff, I actually talked to Mrs. Skelly the other day. She's the one that we condemned her house a while back. She's having a hard time getting back in with some things, so we're helping her out, finding some electricians. We found some people over at the Community Economic Development. Elaine helped me find somebody, so we found her an electrician that can hopefully help her get back in her house, electricity back up and running. So that's a positive thing. Besides that, we're working on the budget, which we'll be doing next month, is approving the budget for 2023. When you guys get it, understand that it says temporary budget. That's because that's what it's called. So you do a temporary budget in December, we do ours in November, that way it's in place by January, because the budget commission has to vote on it. We then do a final budget, which is called a final temporary budget in March. I try to do ours earlier than that. That is our last, we get 2 chances to do our budget. The first one's the temporary in December. The second one in March is considered our final temporary. That's the one that's in place, and everything after that, we do addendums to that. That's when you guys sign off saying, yes, we increase appropriations by $1,000. That's that. Also, one of the new business items we're gonna skip over, well, we can still vote yes on it. If we can't use it, we can't use it. But in the new business, one of the items was then and now certificates. So then and nows are when we don't have a purchase order open to make the purchase. Oftentimes that's because it's a refund from either a court proceeding or something else. Up until now, we have always taken it to the board to approve. My only problem with that is for $84, we're gathering all of you together, we're waiting possibly 30 days to do it. Then I've got to have everything signed off, and I have to give it to Carolyn, she processes it. Costs us $400 to give $84 back. And I'm just making a bold assumption, it's probably $400. I talked to Ron Lighty at the county auditor's office yesterday at the county commissioners meeting, and I said, hey, why do we do it this way? Because I'm not used to doing this in other, I'm not seeing other counties do it the same way. He looked in the ORC, anything less than $3,000, we don't have to. The process has been we do. So I'm gonna say anything less than $3,000 you're not bringing to you guys. Even on the expense report though, it says then and now, so you would see a then and now. And the motion was, and I've asked Linda Applebaum this, she didn't get back to me yet, was can we have approval to, you guys delegate to me the approval to sign off on those? You're still gonna see at the board meeting anyways, you still approve the expense that way. But what it does is it cuts out the red tape. When we do a refund or we've got to buy an emergency purchase, like right now if we have an emergency purchase, I purchase it personally and I get reimbursed. Because that's the only way to do it. Plus how long it takes to get a check. As an example, we have a lunch coming up where we're doing the community health needs assessment review. It's $400 in lunch for, I mean, it's less than $10 a person. But to do that, we can't get a check in time to do it within, it takes about a week to get a check. So instead, I just buy it and then I get reimbursed. If we did it any other way, it'd be then and now. This is my way of getting the then and now taken care of where it doesn't cause more headaches, which is not that abnormal, it's pretty normal.
And 3,000 is the limit.
3,000 is what the ORC says, and then it has to go to the board, but the thought is if you guys delegate authority, we don't have to keep coming to you
Right.
saying here's the then and now.
For up to
Yeah.
Or
2,999.
put a limit on it.
And the only one that I'm aware of that exceeded $3,000, or Carolyn has exceeded in the past, I'm gonna guess 5 years ballpark, that's how long Carolyn's been here, was, it was one item that's for legal expense, and that was it. Because we started doing it before PO, so we can't have PO till the contract signed. So, it was one thing. So this $3,000 should cover 99.99, nines of everything. But if legal comes back and says, hey, you can't do that, we don't do it anyways because we can't. But at least for right now, we can avoid coming to you guys just for peddly little $20, $80 reimbursements.
So you're waiting for legal right now to give you the okay? for
Yeah,
okay.
yeah. We can
So
do
you don't want a motion tonight?
No, 3,000 and below we're totally allowed to do. Above 3,000 is the issue. And
Oh,
the goal was, just let me have authority to do all of them, because they still come to you guys, and obviously I'd give you a heads up if there's something crazy, like $5,000, $10,000, I'd give you a heads up like I wouldn't do any other time.
Well, they're still under C, under new business, there's a.
Yeah, we can table it.
I would just, or we can approve it, but just go and state up to 3,000.
Well, the 3,000 already is allowed by law. I can do that through the ORC. But we can table that for now until Linda gets back to me, and then once Linda says yea or
Let's do
nay,
that.
we can do it.
Yeah.
You know what?
Yeah.
yeah.
And I mean, there's very few things I can think of that would exceed $3,000. Very few. It'd be an odd duck type of thing. Other than that, we've just been dealing with day-to-day things, hiring the staff, like Carol mentioned, we're getting back to that. Dan and I have the posting out for sanitarians to get them onboarded for O&M. Dan's working with the software company, which we'll talk about later, to get that up and running, just things of that nature. The fiscal report, which also underneath me, you guys have a copy of that. There's nothing too crazy in there. It's kind of what you'd expect. I'm gonna scroll down here. Where's the one? There we go, there's the chart. As you can see in there, some of the revenue is a little bit higher, a little bit lower. The reimbursement was some of the stuff that we've gotten back, we didn't expect to get money back from. We're gonna do a better job next year, kind of aligning these things in the right line. Because what tends to happen is we get an odd expense or reimbursement, and it's just not categorized in the right line sometimes. It's still the same thing, but it's just not even named the same thing. So we're working on making sure that's a little better.
So is that why maybe some of these expenses are already over budget or something like that?
Yes, that's why some of the expenses are higher or lower.
Like that.
We do have to next month, we're gonna lower a bunch of these, because what the county auditor does is he wants to see within reason of those. So we'll bring it back and we'll lower them. A lot of them were COVID grants, because we expected at the time to have probably well over $2 million in COVID grants. I don't think we haven't spent a COVID dollar except for the vaccination grant since January. Maybe March the latest, maybe there's some in March, but it wasn't much. So actually it was January, because we just did that audit and we said we haven't spent anything since January. So that's the reality. We have these grants out there, we're just not using them because we don't meet the criteria to use the dollars. Because there is a tag on with that. The expenses will do the same thing. We'll have to decrease some of the expense lines, because as you can see, most of them are at like 50, 70, 40%, stuff like that. So we'll reduce some of those as well. And again, it's mostly just due to the COVID stuff, the grants that we didn't have that were expected. And the cash balance line, I can't rotate this on this screen how I have it set up, but which is useless on there. But the cash balance lines are still pretty healthy. Obviously, the biggest cash balances are the EH funds, because we haven't transferred money back and forth yet, and the general fund. Those are the two biggest ones revenue-wise, which is typical. It's been that way since I've been here. There's about 3 funds that have all the money. And then we still do the chart for like Dr. Rood and anybody. The reason for this chart is so you guys can see the revenue and the expense month to month. Now, obviously, revenue spikes when we get our tax, or our tax assessment, or our levy money, then it goes down, then it comes up. But the goal is just to show on average, is revenue outpacing expenses, that's the main goal for this thing. You guys have had it now for a while. And in general, revenue does tend to be right behind expenses, except for when the levy money comes in, or a big grant reimbursement, that's the other thing. So that's kind of that. And that's it for the finance side.
Questions?
Yes,
Okay.
please.
So the public entities pool, that insurance,
Yes,
is that an annual premium that we're seeing on this, distribution report?
correct, yeah. We pay a yearly premium like any other insurance, and then
Yeah.
we are allowed by law to split it up amongst the funds if we have a methodology, or put it all in the general fund. We split it up because then we can charge it to our cost methodology for food, we can charge it to the cost methodology for other things, and the reality is 75% of our staff are EH here, if not 85%, just go off numbers I got, so.
And then, is that premium consistent year over year, or is that
Yes, generally.
It depends on the amount of coverage though, right?
Yeah, there
Well, I
was.
was gonna ask that too, and what is
We
covered under
ra-
that policy?
We recently raised that, like, when Dave was here 3 years ago.
2 or 3 years ago, we increased it because you can.
'Cause it was only a million?
It was $1 million or $2 million. I don't remember what it was
And we
exactly.
upped it.
We increased it because what tends to be forgotten is your assets, like the internal assets. We don't own the building, right? We've not owned the building, at least as far as I know. So if the building, so I'm gonna use Lake as an example. When Lake's building burned down, you need an asset line, which was internal to the building, and you need a building line, which was the building itself and the external parts of the building. Here, we're only internal. The amount we had wouldn't have covered what was in the building, more than likely. So we raised that up a little bit to cover the internal things of the building. Plus, we also knew we were coming here, and there's gonna be newer assets, and more staff. So we raised that a little bit, not a ton. But public entities pool is, I'm trying to think, there's only two or three insurance things that you can get that I'm aware of that are any good that cover public entities. Because you can't, like, even if I wanted to, I can't go and get insurance through like Progressive for us.
Right.
Because it has to have, we have because of liability coverage we have and how it works. There are some increases, usually because it's a pool, something catastrophic happens, like catastrophic. But even then, it's minimal at best. The pool's pretty good about maintaining its asset lines, and we get a report.
That's a significant expense.
Yeah, I mean, for us it is,
It's like way more than I pay for like malpractice insurance or something,
yeah, so keep in mind for us, if let's say, I'm trying to give a good example. Let's say a tornado comes through and totals every car we have, like 10 cars get taken out. We pay $1,000, they're all replaced.
Okay, so that's your car insurance.
Car, liability for all of you, all of us.
Yeah.
It is, we don't call it malpractice, but it's like errors and omissions.
Right.
Equipment.
Anything property-wise that we own, it's equipment, it covers literally everything we do
Okay.
here.
So it's,
So it's very comprehensive.
Correct, and I can tell you from dealing with them in the past, it's phenomenal. I mean, you pretty much call them and say, hey, something happened. Usually they deduct from the check whatever you owe them $1,000, and it's fixed like overnight.
Well, it should be for that price.
Yeah, drivers. Yeah,
It's driving, it's all drivers and for the drivers insurance.
Okay.
right?
the county uses Corso, which is, I don't remember the abbreviation, but it's a county whatever pool. We use public entities pool, and public entities pool covers, I pulled the report that they just gave us, but it's like, because the township, a village, or health department, they cover them. It's across the whole state of Ohio.
Okay, and then can you talk about this, I'm gonna pronounce it wrong, but the Carasoft Technology Corporation, it says it's a
Yeah.
licensing fee for the software, but what is the software?
The software is environmental health software,
Okay.
so that's the operation maintenance, the food, the hopefully growing the nursing, other things. That's that software that we bought a couple years
Okay,
ago.
that's what I assumed,
probably
okay.
years ago.
Okay, so that's all that thing. All right, so under expenses, it says, item 2, legal fees are showing under budget. I was a little surprised by that considering the cost we've, been incurring for
Yeah, so
records requests.
that's because we increased the budget.
Okay, so that's why it's under budget.
Yeah, she probably could have left that off of there, but Carolyn was just doing anything significant in her budget. But yeah, we just increased that budget line because if public records kept coming in, we'd have been then and now again, because we just said, hey, now
Okay.
we can't pay.
So it's under budget because we significantly raised.
Because I raised it, I think $50,000
The budget, okay.
last,
That makes a lot more sense to me
Yeah.
than, saying we're under budget.
Yeah, it's not like under, it's just, we raised it up significantly.
It's like a faux under budget. All right,
Yeah.
that's all I have.
Yeah, all right.
Okay, Lynn, you got any questions?
Not today.
Did I get them all?
She's like, Carol would beat him up, we're
I
gonna leave
have
it.
the advantage of being here a few more months. So
Mark, you
that's-
good?
I'm good, thank you.
Ashley, you're good?
I'm good. Carol
Okay.
covered it.
All right, so do we have, make a motion to approve the finance reports for October 22 as presented? Okay, we have a motion, we have a second?
Second.
Okay, all in favor, we need roll call vote?
No, it's all in favor.
All in favor?
Abstention.
Aye.
Okay, any opposed? Any abstentions? No? Okay, so that passes, good. All right, next is old business bylaws. So
Give me one
who's up
second, I
on
gotta
that
pull
one?
this up. I was asking all these questions, I wasn't ready to.
I've got it up on here too.
So, I'll just ask, since we kind of worked on this as a team, all of you looked at these, spent time looking at the red line?
From the last meeting that you guys did, yeah.
Yes, okay.
Okay, so I'll just say, make a few comments, and then I was gonna go basically section by section, highlighting some issues.
And I do have it up behind us in case anybody wants to look at.
Okay. So I'd say the goal of redlining these bylaws was to make them consistent with how we actually operate as a board, because initially it's a lot of like health commissioner does this, health commissioner, and that's just not what we're doing, you know, it's administrator. And then there's some minor changes as well, and if I had to guess, I think there was like a lot of copying and pasting that went into these bylaws over the years, like, you know, maybe somebody wanted to add something, and so they found them from a different board's documents, and they put them in, but it wasn't really a cohesive document with consistent terminology. So we kind of cleaned it up to make it a more professional.
Yes, lots of it is just cleanup and being consistent in the different pieces of language.
Yeah, I think that's,
So,
So do we change the, where it states commissioner to administrator?
Yes.
so sometimes, but I'll go
Yeah.
through that, because there's
Hold on.
sometimes the OA, yeah, you're kind of getting ahead of me.
Sorry.
Hold on.
I'm sorry, okay, go ahead.
So there's sometimes the OAC or the ORC specifies that the commissioner has to do X, Y, Z.
Mhm.
So in those cases, we can't really change it to administrator, but otherwise we would. So that was kind of, I'd say, the goal. So guidelines is, I'll just go through these. If you have questions, feel free to interrupt me, but let's keep general feedback. I like this, I didn't like this, whatever, to the end, and then we can kind of go through that all quickly. Okay, so starting off with Article 1, mission. So right off the bat, you'll see I changed the language to be the Geauga County Board of Health, or there and after the board, and then the board is just used consistently. That's just good drafting practice. And then as far as the rest of that paragraph goes, that's sort of an acknowledgement of balancing factors with public health, of having to look at law and ethics versus looking at the general health of the population. And I guess you could also say there's like a financial aspect too, right, which isn't necessarily limited there. But and so that second sentence in that first paragraph, that comes, I think there was a comment that unfortunately got deleted in one of the drafts, but that comes directly from the American Public Health Association
too dark.
Code of Ethics. I thought I loved it.
Does,
There.
It is
Good.
working now.
does that citation include the term absence of domination?
Yes, it does. That's all directly from, so the American Public Health Association, they put out an ethics manual, which if you Google, you can find online, and that's just kind of a copy paste job from that manual. And I mean, it seems like that's kind of the organization that governs ethics in public health. So then in the second paragraph, you'll see we changed commissioner to administrator and commissioner, and I don't know exactly what they called Geauga Public Health before, but you know, it's the full name would be the Geauga County Health District, there and after Geauga Public Health, and so that's the terminology used throughout. Okay, so moving on to Article 2, board duties. This is mostly just cleaning up this section, that first paragraph. There is a reference that we have to abide by the requirements of the Ohio Public Health Council. Did a little Googling on Ohio Public Health Council, couldn't find it. Could find Ohio Public Health Association or the Public Health Services Council of Ohio. I don't know if those were maybe one organization that split on two. I don't know what's going on, but I couldn't find anything that's the Ohio Public Health Council.
So, Adam, do you have any insight to that? Because
That one I do not know off the top of my head. It's
Okay.
possibly just a side name for something else, and I can look and see if it.
Yeah,
something
you can
else
see
is
if there's
called that.
anything else. But my guess is, whatever that is some sort of association that we do not actually have to abide by. So my recommendation would be just to delete that part and requirements of the Ohio Public Health Council, because if it's just an association, those are just recommendations, and that's not something we have to abide by. So that would be my recommendation, was there's a compelling reason why.
take out that whole sentence.
Yeah. Well, no, not the whole sentence, just the part that,
Or
And-
health and requirements.
yeah, the clause that starts "and requirements," I would delete that. And let me pull up my original bylaws real quick. Okay, so then under board duties, this was originally listed as the objectives of the Board of Health, and then listed this, and we changed that to responsibilities.
Because they weren't, it didn't make sense that they were objectives, they're really responsibilities.
And one thing that Lynn suggested that I think was a good suggestion is incorporating parts of the ORC and the OAC directly into our bylaws, because I think a lot of times when you have a new board member onboarded, they're not necessarily reading all of the applicable OAC and ORC provisions. So we tried to sort of incorporate that directly in the bylaws to make it a more comprehensive document that's more helpful for board members going forward. So that's what a lot of these changes are, as far as like adding the requirements of a health commissioner. And then you'll see we also added a full-time administrator to be consistent with how we are operating currently, as well as the financial
And
reports.
we listed who can be a health, what type of professions can be qualified for a health commissioner, because it was, we kind of went back and around about that a couple times, now it's in print.
Okay, so moving on to Article 3, which is meetings under Section 1, regular meetings. The last sentence of that paragraph states, notice of any board meetings or board committee meetings shall be sent to local news media and emailed to all board members to provide receipt at least 3 days in advance of the meeting, and shall include an agenda and minutes of the previous regular meeting. So I had a question, are an agenda and minutes of the previous regular meeting, is that provided to news media, or is only the notice of the meeting provided?
It's
to news?
the agenda is provided for the upcoming meeting, as far as I know. I think Alta still does that. And then, as you all probably saw, everything, including the direct reports, are now included on the website as well.
Okay,
So those go out.
but
But
media,
not minutes, we don't post the minutes there.
Minutes go on our website.
but not to
On the
media,
website, but not in
right?
the media.
Local
All right.
media, okay. Lynn, can you make a comment in that regard that, so local media receives the agenda?
Yes.
Okay, but not the minutes. All right,
We
moving
would
on.
just reference them to the website, and we've done that in the past.
Yeah, that's a good point too, and could you also make that note, Lynn, about that, that information is also available on the
Which one?
website.
Oh, yeah.
Public.
We reference them to the website.
Okay, Section 2, special and emergency meetings. So there is a distinction in the ORC regarding special and emergency meetings. Special meetings require 24-hour notice, and emergency meetings can just be on the fly. It makes sense, right? If it's an emergency, you need to have a meeting immediately, and you just provide it notice as soon as you can. So we added that. I noticed a lot of times our meetings are actually, like I think one of these last meetings was labeled an emergency meeting, but we gave notice as if it was a special meeting.
So what is the difference between special and emergency?
It's the notice, so we strive to, my understanding is since as long as I'm here can remember, we strive to do a minimum 24-hour notice, even for emergency. You can call it special, my understanding is usually we just call them emergency meetings, but we still give 24 hours notice. And the goal is obviously if someone wants to attend, we want to make sure they can attend. I don't want it to turn into like, hey, we don't want someone to attend, it's an emergency, and just give like 2 minutes notice. I think 24 hours is the minimum unless something catastrophic happens.
Well, and I think that language I pulled there, that emergency meetings are special meetings that are needed because a situation requires immediate
Yeah.
action, I'm pretty sure that's directly out of the ORC.
It sounds like it is, yeah. We could label them special, I think we just label them emergency, that's just been how we've done it for a long time. We call them special.
All right, so is there any objection to having special and emergency meetings? Both?
Well, let's just maybe handle all that feedback at the end, would be my suggestion.
What about the first paragraph, section 2, vice president, that should be pro temp?
Yes, I actually have that in my notes, you're right. That was because we made the changes and then realized we had to make them back, so yeah, I actually do have that in my notes,
Okay.
Rich, so good catch there to change that back. Okay, and then a lot of what we did in this section was just kind of organizing it a little better under categories. Okay, so then I think all that happened with that meeting's minutes is that was moved from a different section. And, okay, so section 5, quorum, this was just making the language a little more clear that if we are ever down a member or 2 members or whatever, a quorum is still out of 5 members, even if we only have 4 seated members.
Mhm.
So that was something that Adam pointed out and just made that a little more clear. Okay, so discipline. Again, this was just a little bit of a clarification, talking about an absence having to be excused in advance, and that it has to be, discipline is based on the president's reasonable judgment, not just based on his judgment, so just a little bit of tweaking there. So Article 4, officers. Okay, so this, one thing that's set forth in the ORC is that the health commissioner is actually the secretary of the Board of Health. And so that's not something we can change, but we did state that the commissioner can delegate his duties, his or her, I suppose, duties of minute taking to a staff
Hard
member.
pass, right?
Yeah, of Geauga Public Health.
Yeah, I know we talked, so he knows, I'm not aware of, besides the secretary being like, you just kind of help the meeting flow. Like,
Yeah.
I've never seen a health commissioner taking the minutes and transcribing it, that doesn't happen, that's delegated to a clerk of some sort.
But we don't
Thank God
want,
for all time.
we don't want
Yeah.
anybody to think that
Correct, yeah.
Dr.
I gotcha.
Cameron should have his pen and paper out.
Yeah, so exactly, just one of those, like, consistent with how we operate as a board. So regarding section 2 vacancies, this is something that we had some trouble with because it wasn't clear to us if this was talking about if there's a vacancy in the position of president, is one off or the president completely steps away. And so I think I had questions as far as how this has been done in the past. Because it seems, if you just take that away, it seems pretty clear that the president pro temp would step up anytime the president is away for one meeting. But then what happens if the president completely steps away?
And
So-
that's the question, is this paragraph here, section 2,
Yeah.
vacancies, is that referring to a temporary vacancy for today, Rich doesn't show up? Or is this talking about permanent vacancy? And so,
Yeah, so Rich,
I mean-
do you remember, I mean, as the most senior member of the board and as far as term goes, has that ever happened that the president pro temp or the president stepped away from the organization or vacated the position that they had?
Was,
Not to my,
what's his name still president
Jim?
when he stepped away, Tim Gruden, or is he not president
I
anymore?
think his term might have been up.
Okay.
The only ones I remember is the doctors.
Yeah,
going,
right,
you know,
Tim
Yeah.
Gergen did step
resigning
away,
before.
but I don't think he was president when he stepped away, or his
No,
term
I
was
think
up.
Dave was.
Okay, so how do folks think that that should be handled if a president or a president pro temp completely stepped away? My suggestion would just be to have a new election
I was gonna say by vote.
by vote. Okay, so the same way that they would be elected would be the way that
And
if there's a complete vacancy.
and we're not gonna address a temporary vacancy.
Well, I
because-
think it is implicitly addressed, because if you go to the duties, the president pro temp, it says that, that
Yeah.
duty shall perform the duty of the president in his or her absence and provide the president.
I mean, I think your president pro
So-
temp, your
Temporary.
I think your VP handles like, someone has an emergency for 2 months, I think your election is, my personal, your election is when someone says, hey, I'm just done, I have to walk away.
Right,
Right.
okay.
Yeah.
And then HDAC comes.
So,
Well, yeah, for a new person too.
so I'm just thinking that the language can be simplified by saying,
Yeah,
not even to talk about temporary vacancies.
Yeah,
I think, yeah.
Because it's understood,
I
Rich,
think in-
Rich is not here, Ashley takes over.
Yeah, I think duty spells that out. I think your,
Right.
your vacancy section is for the long-term,
Okay.
like,
Or-
I'm gone.
Yeah, so could you make a note of that, Lynn, that will clarify that that is for someone completely stepping away from the position. And then under duties, we just added the secretary, since the secretary would technically be an officer of the board, that person does not have a vote on the board, which is of course consistent with how we function.
Correct.
Okay, as far as committees, I mean, I have a lot of questions about that, because I haven't seen a single committee since I've been here.
And in here, it does talk about standing committees or personnel, finance, audit, sewage, strategic planning, shall consist. Are those still? The committees?
You as a board have to vote on those. If you do it like Summit Star, well, as far as I know, the other counties that do that kind of stuff, you guys would create your own. You then usually vote 2 members on, you can only do, you can't do more than 2, it's
Right.
quorum. So you would in essence, what I expect normally happen is you create your committees, then every year I'd have a list, and I'd hand it to you, and you'd each sign up for whatever committees you wanted. And the goal would be 2 people on every committee, those people hold the committee, and then someone wants to swap, usually like January of each year, you would then say, hey, who wants to sign up again? And the goal would be, unless someone has like a lot of experience in it, to have people swap, so they can see different parts of, you know, if Carolyn's always on personnel, you wanna have maybe on sewage, so she has some experience in sewage, and then Ashley has some experience in HR or something like that.
But we as the board have to decide what our committees are.
Yeah, I mean,
Well,
you
and
can
or if we
do-
want them at all.
Yeah, you can do, so you used to have committees, and then I wanna say it was 2-3 years ago, we got rid of the committees, because,
Right.
I mean, like, so O&M as an example, we had that for a little bit. My concern was none of the public was coming to the O&M meeting, and the
Yeah.
concern with that was, we're gonna rehash everything we did at the committee
Right,
meeting back in
right.
here, so the public can hear. Why not just pull into the public?
Yeah, so, I mean, I guess my observation, and I didn't wanna completely axe this section as, you know, a relatively junior member, but, you know, generally what we do in here, we have these discussions together. So I think it perhaps makes sense just to completely eliminate committees from the bylaw.
And or you could leave them in there, just not use them, it's up to you
Yeah,
guys.
well,
And
I guess
you-
that would be the other thing to do, is to make it flexible, so that they're not necessarily standing committees, but that there's an ability to have an ad hoc committee as needed.
And my recommendation is if we do committees, have it right before the meeting, so have it 4:30 to 5.
Yeah, right.
So the public knows, hey, I'm already coming into the building, now I can just go there, I go there half an hour early, I can be there for the committee that rolls right to the board and then votes on what the committee did, or at least here's the committee out.
Okay, so maybe we want that flexibility of not, rather than having standing committees, just being able to have ad hoc committees
Ad hoc
as
and
needed.
permanent.
Okay,
So if
And-
you just change the verbiage to the ad hoc.
all right, so I can, I'll
And the perk for that is, at least the reason I would say to keep committees is if we have a super heavy hitting subject, so like let's say O&M, but something a little bit different. If we have something like that, all of you meeting here, you might not be able to hammer it out every single night. So let's say we have a bunch of other things on the meeting agenda. So instead, the committee would be hammer out 90% of it, then take it to the board and say, here, it's 90% done, how do you want to fill the last 10%? Then the board says, yeah, it fills in the last 10%. So there are reasons for
That's
that.
kind of what we're doing right here. Two
Right.
of us went off and
Right.
did the bylaws, and now we're back here saying, here's
Yeah,
food for thought.
You were in the ad hoc bylaws committee.
right. So I mean,
I don't think we want to call it a committee
it-
though.
it wasn't a
that's
committee.
not- it was not-
It wasn't a committee this time.
Was
You
not a
guys,
committee.
you guys just took
No,
on some stuff.
No, it's a head.
Yeah,
So,
but in the-
let's be clear.
But in the future, you can do like work committees and things like that, or work groups, you could do that. And there is a purpose for them, it would just be, is it worth it or not based on the subject? I think.
So is it safe to say the president shall announce if ad hoc committees are needed? I mean, is that what we're saying? It's the president's the one.
I would think it's a decision of the board.
Yeah, I mean, I would say if Ashley or Carolyn decide, hey, there's something I really wish we had a committee on, I think anybody could go to Rich
Yeah,
or
I
go
think
to me and
so.
say, hey, I wish we had a,
I think we could,
whatever.
I'll make that open-ended, Lynn, so that we can make it pretty flexible. I don't think there needs to be a really stringent protocol.
I would say, I would hate to like landlock you guys to only being able to do something in here,
Yeah.
because
Right.
what if something crazy is going on and this meeting now goes 5 hours because you can't meet beforehand? That's all I would recommend.
Okay, so moving on to section 7, board protocol. For section 1, educational activities, that just, again, it's just some clarifying language that continuing ed can be online or in person, and it's 2 hours per calendar year. Regarding, let's see, section 2, authority, I have a question. Okay, so there's a sentence that says, at all times, even in the midst of a crisis, the administrator or appointed staff and not a member of the board shall be the liaison between Geauga Public Health and the media. And I just made a comment that the board could still have its own liaison with the media. So to the extent the board, I mean, this is kind of doomsday stuff, right? But to the extent the board needs its own representation to the media, that could still occur. The board couldn't represent Geauga Public Health, but we could represent ourselves as the board. And so I asked the question, do we need to state this explicitly, or do we just leave that language silent, which would still allow for it?
So I guess the question would be, we have a PIO, a Public Information Officer, who's that's their task. And obviously I handle some of it, but the board is generally policy and top level. It's not interaction with staff or interaction, unless it's approved, or interaction with media. So that's the only concern I would have is we'd be going outside of what the board's intent is, and plus it could conflict with what the PIO says or someone else says. I can't even think of an example. This would be, I don't know. Yeah, I'm just.
Yeah, that's why I say it's kind of a doomsday situation.
I'm just
in which,
spitballing.
like, there'd be conflict between Geauga Public Health and the board, that we would need separate representation, but we can just leave it as is, which I think is fine.
Yeah, I guess I would. So you guys as the board pretty much are Geauga Public Health. I mean, I know we have like myself, Dr. Cam, we have the directors, but you're our bosses. So really, you guys give us direction to go, right? I mean, that's kind of, and plus you're supposed to be the will of the people, right? All 5 of you are supposed to say, hey, the population wants this. Kind of a delegate for president, that's who you guys are. So then I'm paraphrasing things. That's kind of what that goal would be, I think. You guys would tell us like, hey, I don't want to see that again. And then we wouldn't do it again, or whatever, if that was the board's decision. So.
I understand where we are with that, and I understand that that would be 99.9% of cases. But, and I don't know what the answer is, but there's potential that all of a sudden, lots of things could go sideways, and somebody from the board will have to make some statement, but I don't have any recommendation, suggestion, but things could go sideways, and we just need.
Yeah,
I think that the bylaws would still allow that even without having that explicit.
It's just, it's a weird scenario, so that's the only reason I say it's just a weird scenario. And I think legal last time said that, well, I can't remember what, we have to ask her.
I was gonna say, it's that
Yeah.
approach is just kind of what legal and
Well, I think like what I can remember when we had to dismiss the last health commissioner, there was I had TV stations calling me, everybody was calling for, a statement. And I remember we only, we went to Linda, the prosecutor, and we just had a statement that, he was dismissed, no comment, no further comment at this time.
So maybe that's it.
Other than that, I think we still, even if we have a disagreement with the administrator or commissioner, I think we still need to work in unison to put out a statement.
And I'm not saying do or don't, Carolyn or Lynn, I'm not saying that, I just want to make sure that we don't, it's for like 10 years from now, 20 years from now, we're all gone, it doesn't get used, where the board is almost like fighting.
Yeah.
No, I think what the language we have now is perfectly fine, based on this conversation.
And I think the default would be like the last time is we just go to the prosecutor.
Right.
All of a sudden, we're like without.
Because we do like when I email you guys, we have the person from News 5 that wanted to talk. Which they actually postponed it till Friday due to a story in Akron. I let you guys know where things are heading, just so you understand where they're heading. Which I think, no matter who's in, Dr. Cameron, myself, whoever's in the future, should be communicating that to you guys, so you at least know what we're saying. Because it's the reason I talk to county commissioners. I don't want them to think we're going in the opposite direction that we are. Because then that, if the left hand doesn't know what the right's doing, the body doesn't work, so.
Okay, so
anyways,
so one thing we could add, so this is not currently in this section, but under this board protocol, perhaps before or after nepotism, would be a section on conflicts, which is something Ashley raised. So I just drafted some quick language before this meeting. I can get to you in email, Lynn, but which would be whenever a member has a direct personal or financial interest in any matter coming before the board, the affected member should do the following: A, fully disclose the nature of the conflict of interest, and B, withdraw from discussing or voting on the matter. So that was just something I just kind of threw together. But I guess I was gonna ask, what has been the protocol in the past as far as dealing with conflicts of interest? I mean, I serve on a nonprofit board, and one of the very first things we do every meeting is disclose conflicts, like at the top of the meeting, you know, based on the agenda. I don't know if that's how your nonprofit functions too, Lynn, but you know, one of the very first items is, does anyone have a conflict based on the agenda as presented? And then people disclose those conflicts. So I just wanted to bring up the conversation on how folks thought that conflicts of interest should be handled, if those should be expressly disclosed and so forth.
Yeah, the county auditor should, I have to follow with him, there should be a form coming out. I know in other counties they started doing
Okay.
this, that you have to disclose it. Now before it was only staff, so it'd be like me, Dr. Cameron, Carol, Dan, and the staff. They've started asking for board ones now as well.
I think we did one, when was that?
It was a while ago.
Before you, yeah.
I just
a
haven't
while
gotten
ago.
one.
But that's what I'm wondering, is it
And it might be
yearly?
January 1st, we might get it, so it might just be
Okay.
every January 1st. They can be some different cycles. But yeah, I mean, the conflict fish is always what I worry about the most, just because I don't know each one of you, and let's
Right.
say, I'm just using Dr. Ruiz as an example, let's say he deals with some dealership, and we're like buying from them, and he's like, yeah, I go over there, and I don't know if he knows the guy, or that they're brothers, or whatever. That's more of what I get, is what I get, I don't know. And it gets you in hot water real fast.
I don't think it would harm us to put a statement in there about conflict.
No, I'd prefer it.
Yeah, I agree.
So
Alright.
from what I said, is there anything like more specific folks want to hear in the conflict of interest section about how disclosure would be handled, or?
Until I read it.
Okay, so just
Okay.
something.
I say let's put it into the,
And maybe, Lynn, if you can email Alta, because I know she has a copy of it, maybe get a copy of the current conflict of interest form from the county. We can include it in the bylaws, so when someone gets the bylaws, we have to fill it out. And that way we don't wait in case it's not cycling. You guys get elected March, April, not January 1st.
Right.
So a lot of things are done January 1st and then not, it's just different. Obviously, you guys don't disclose your conflicts. Maybe we put that form in there and just say, hey, here's the form. You fill it out when you get hired or appointed,
Yeah.
sorry.
It's never a good
Yeah.
idea to
Just
overcomplicate.
automatic.
Yeah.
Might be an easy way to cut that.
all right, I'll get, if you could just have Alta send that to
Yeah.
us.
Yeah, well, and that might be just the way to do it, is just discuss it as far as the form goes.
But I think, yeah, we can sit there and say that it has to be something that
Okay.
has to be signed.
Okay, got it. And then as far as section 4, legal action, I think we can just go right through that. That's just keeping that language tight, pretty much. Which brings us to section 5, sunshine laws. So Lynn and I thought it would be a good idea to explicitly put some sunshine law information into the bylaws, because this has been a pretty important issue as of late due to public records requests. So I just linked where folks can read more about sunshine laws. And then one thing I thought about after I wrote this is that I should probably include that we should not, so it says, we can't delete any communications related to board matters. I think an exception to that would be except as allowed by any retention policy, to the extent there is a retention policy. So that's,
There is retention policy.
okay, so, Lynn, could you make a note of that under the sunshine law that, so board members may not delete any communications related to board matters except as allowed under an applicable retention policy, something to that extent. And then Article 7, compensation and expenses. The prior compensation was $30 per meeting. Adam suggested we bring it to the statutory amount of $80 per meeting, which would be in effect the first of the year. And then I know most board members waive this compensation, but one thing we considered is we have gas prices, and location change and so forth, folks may want to unwaive the waiver, so that's why I added that sentence about revocably waiving the.
And we'll open that back up January 1st so that everybody can opt in or out, because we try to do at least for a year-long period, so the auditor's office doesn't get annoyed at us going back and forth. But my understanding is that $80 is at least supposed to cover your guys' cost of being here. So I look at it, figure, we're generally here around dinner time, so you guys probably $20, $10, $15 towards dinner, you get your mileage. $20 isn't doing it. I mean, most of us can't drive here and do anything.
Well, I don't think, and I can tell you since I came on the board, it was only offered the first time. It's never been discussed on an annual basis. to
It
offer.
has not, and I would like to bring it up on an annual basis for those who want to opt in or out, and we can just every January 1st, actually probably do it in December to be effective January. So every December, we would just say, hey, who wants to opt in or opt out? And you can still opt out, I mean, because there were some tax implications that almost everyone opted out for, but it's up to you as a board member. And $80 is what's in the code, so and that's usually pretty status quo.
I think once a year we get, from the auditor, he sends us the forms to fill out anyway.
I've never seen anything.
No, that was internal.
We are appointed.
Yeah, that's internal only. It's not from them. You get a form just because it says you got X accrual, but the rest, nobody else gets that.
Okay. So I think everything else, amendments, I actually did not amend the amendment section.
What?
Karen.
All right, I know.
She was
You know,
thinking-
some things are okay, guys.
And I think-
did, the only thing I changed was that little dash, I wanted it a little thicker, so that part was amended, but I wasn't gonna get into that, because then I just sound mentally ill. Okay, so moving on to Article 9, executive session. So this section, I mean, I'll just be frank, on the original board, or the original bylaws, it's just a mess. It just has bullets that it's just not very well organized. So what we did is just kind of added a little introduction about what an executive session is, how you go into executive session, how you get out of executive session, and then it ends with the reasons for why you can get into an executive session. If you read these, A through G list, and you're like, some of these are crazy, where did you come up with this stuff? This is right from the code, I didn't come up with any of it. So if you thought it should be amended, you're right, but talk to your congressman about it. That's just straight ORC, and I think that is it.
Second paragraph, Carolyn, the last sentence should be roll call vote. Not majority vote. Has to be a roll call vote.
Well, it could be both, right?
Yeah, I think it's
Not
a roll
for
call,
executive.
because that's to account for who's going into it.
That's what we do, our practice here is roll call.
Yeah. It still has to be majority vote though, yes.
Yes, but, so it would be
But-
both, or
Yeah.
majority
Yeah.
vote by roll call.
Yeah.
Yes, okay.
That's fine, we
Thank
can
you.
add that, that's a good suggestion. Okay, so I think we did anything, questions, comments, feedback?
I think overall it looks very good. Thank you guys for taking the time to do this.
It's a
So-
lot of work.
Can we talk about next steps?
We,
And
So-
could we put in there somewhere that you guys will review these December of each year? I mean, I don't think it's a bad idea if we put in there that we'll at least review
annual
them.
review,
Yeah,
or something.
I mean, just to avoid this issue right
No, I
now.
agree.
where-
Any policy
I mean, I think it
we
could be
have should
biannual, I don't think
Or
we
biannual,
necessarily need
yeah.
to do it every year, that might be a bit overkill, and it may end up that they just don't get done, but it has to be done.
I think there's at least some accountability at that point that, hey, we are gonna look at these. Plus for
Yeah.
accreditation, we're supposed to do that anyways, so it kind of puts that ticker on there of hey.
Yeah, no, I think that's a good suggestion.
Is there an accreditation standard for how often we have to review?
No, not my understanding.
Okay, so
I just threw out annual as that's the minimum you do every year.
I mean,
Two times.
Well, the
Those
last
things
one,
are
Well, the
right.
last
Time.
time-
last one was done how many years ago?
It was a
Well,
minute.
it was done about 2, and so we're really at the biennial mark. So just, are we allowed to, if Carolyn and I update this red line, can we give it to Adam and have Adam disperse it to all of you before the
The
next
next
board
meeting.
meeting?
Mm-hmm.
So that we can,
Yep.
because we'd like to come to the next meeting with the final.
And sorry, I'll also mention something that I know we talked about and I didn't catch it when we were talking here. It's $80 up to a maximum of 16 meetings. Or
So,
no,
yeah,
18, sorry.
that's a good point, I can see that in the code.
Sorry, it doesn't say no accounts for
Oh,
more
we
than
have 18 in
18.
here.
Right.
She said it was 16, I can't remember if it's 16 or 18, I have to look. I go to the code when I'm not 100% sure, but she said it was 16.
16, all right, I'm
So-
not sure where that is,
We-
but I know it's in here.
Yeah, I was gonna say, I don't know if that's in here, if it's in.
It
No,
is,
it's
it
not.
says
Oh, here,
18.
right here.
After the
Yeah,
mandatory one.
Yeah.
18 is spelled out, that's why.
Okay, so we
So
can,
it's
we
16.
can confirm that. Oh,
Yeah.
it's 16, it says
Oh,
16.
Alta said it was 16, I mean,
Okay.
we can always double check,
We
but
can- we'll
she's-
double check.
She's
Okay,
probably
that's
looking at it
good.
right now.
All right, we will put our heads together, try to correct all this and get it out to all of you,
Mhm.
so that,
We can vote in November.
and we can vote in
Yeah.
November.
Okay, good, thank you guys.
It might make sense to make the review then, instead of every December, every other December, make it every other November.
I think we can
Yeah,
just
we
say
could-
biannually and not specify.
Yeah, biannually and
We can do
Yeah,
that.
I think that's a little easier.
But you're right, in December, yeah, I threw, yeah, 'cause if you don't vote on it, then you're already behind, so that's true.
Okay.
All right.
Okay, so, any other comments about the bylaws? Okay, then the next thing will be
Turn the
environmental.
lights up.
Yeah. Carol's getting comfortable.
It's nice
Envir-
not
Yeah, I
having
know, I
a
can't see
timer.
Yeah,
nothing.
that's good, okay.
Environmental health fees? Okay,
No, this is, health insurance, the fees are just the reading.
oh, okay.
Okay.
I was, under old business, he,
Yeah, I know, and that's why we.
but
some
he,
stuff
skipped to
help.
somewhere, where, oh, he skipped down to new business.
No, the fees are just the next thing on the
Environmental, it's this page.
attachment. You
Yeah,
still
second
follow
reading.
this.
Oh, okay.
That's just what's on the attachment we sent to the public, the next thing is just this.
Okay.
So you're
So
still
do
going
we,
with that.
well, don't we have to have a motion for that?
You are, yeah, yeah. The fees weren't in the things that were posted to the public, so they've already been posted. So when I scroll, this is just the next thing
Got it.
on the slides. That's the next thing on the agenda.
Yeah, okay.
So you're still on that, yes.
So we need a motion to approve the second reading of proposed fees for food service operations, pools for sale of property, state camps, county camps, and operation and maintenance permits as presented. Do we have a motion?
I have a question. I don't know what you wanted to. Why do we have to do all these readings?
We need
Because
three required.
it's required by law. We have to
Okay,
go.
even though we didn't change anything last time, we're not changing anything this time.
We do,
There have to be three of the same.
There have to be three.
we do
this time.
3 readings, and that's so the
Okay.
public can comment on if they're too high, or they're never say they're too low. Right? A little bit too high. Yeah.
Well, I did a little bit of checking, and they're basically 10% or less.
Correct.
Public comment or?
So
Is there
do
a time when the public comments on it during the readings?
During public comment section.
I see, okay.
So do we have
Motion
a
to
motion?
approve the second reading of proposed fees for food service operations, pools for sale of property, state camps, county camps, and operation and maintenance permits as presented.
Okay, thank you. We have a motion. Do we have a second?
Second.
Okay, all in favor?
Aye.
Aye.
Any opposed? Any abstentions?
Extension.
Okay, one abstention. Okay, so that passes, thank you. Now we go to, healthcare and dental rates.
Yeah, so I'm just showing this quick. You guys just approve it for us to implement it January 1st. The county does all of this, like they go out and they bid the insurance, we just buy into theirs. So there is no like, hey Adam, can we get this down 10 cents? Though that is what it is. We go with the county obviously because we have 25 employees give or take. We're not gonna get the rates they get with 1,000 plus employees, it's just not gonna happen. So these are the rates, they actually went up.
Sorry.
They actually went up next to nothing. They're up like a penny here and there, or $1 here and there. It's phenomenal. They did a
very
great job.
impressed.
Yeah, it was not what I expected. It was phenomenal what they were able to accomplish. Some of that's just because I think that the staff are healthier in general, so there's not as much use of it, hopefully. Otherwise, I'm sure it went up. So that's what they gave us. So that is what we're asking everyone to approve. Is the 2023 ones, which I just scrolled down to that one. It's up a couple dollars a penny, but like I said, you could say no, but if you did, we have to go out and get our own insurance, which there is no way I can do that for these rates, as you probably can imagine.
So do we have any questions about this? Okay, so, adopt the 2023 healthcare and dental employee contribution rates as presented. So do we have a motion?
So moved.
Do we have a second?
Second.
Okay, all in favor?
Aye.
Any opposed? Any abstentions? Okay, that passes. Thank you. So we're gonna skip this then and now thing from
Yeah.
B. We're gonna go down to C, authorization of payment of then and now purchase orders. Authorize an administrator the authority to approve.
No,
We're
you're doing the
skipping
one
that
about that,
too.
you skipped the wrong
Skipping.
one.
You're
Skipping
skipping
both of them.
You're B.
Yeah.
Oh, okay. Approve the payment of a then and now purchase order to Geauga County Clerk of Courts not to exceed $84.05. Motion?
I thought we were skipping.
I thought we were seeing both of those, no?
No, 84 were approved.
So the 84, I already had Carolyn approved, but it's already on the agenda, so if you guys just wanna approve it, and then we'll say, moving forward, the agency
Okay.
can do the 3,000.
Okay. All right, so moved.
So do we have a second?
Second.
Okay. All in favor?
Aye.
Aye. Any opposed? Any abstentions? Okay, that passes. Okay, we are skipping the next one.
I just wanna make sure you guys knew before we start doing that, you're
No,
where
that
we're
makes
going
sense.
to, otherwise, yeah, the cart's kind of before the horse. If you didn't want us to do that, if you said, hey, no, I don't wanna just assume you're gonna say yes.
Okay, so the next thing will be the public comment session. So basically, we like the session to last about 20 minutes, unless the board moves to extend it. You each have, if you want to speak, we have 2 minutes per speaker to take comments and questions. Sometimes the board will answer questions, but other times we will wait to, investigate the answers before getting back to you. Board responses will be recorded and publicly filed with meeting minutes. So does anyone, would anyone like to speak?
If you want to just stand up here if someone wants to, I did not move the podium, I got sidetracked, and the timer will be up on the screen, and it should beep when it goes off, the volume is on the TV.
And say, please say your name and
Address.
where you're at, your
Let's
address.
see if that works.
Ms. Briggs.
Can I sit down?
I'm fine with that, it's up to you. Go ahead when you're ready, and I'll start when you start.
Mary Briggs, Geauga County resident. I'm just gonna go through this since I have 2 minutes. Hello, board. Let's see. With all due respect to Dr. Cameron, quote unquote, the COVID thing is still hanging around. I just want to say there's over 1 million people that have died from it in the United States. All right, that said, when you approved one of the minutes, I don't think you put in your motion that you voted on to add the corrections. And I'm just pointing out observation. So, meetings. There was a meeting in the last month or so that I wanted to attend, and then I wasn't feeling well, and I thought I would do it virtually, and I tried to get online, and it wasn't on virtual that night. So are they audio recorded if they're not on this 80p or whatever it is? Tonight's meeting didn't talk about Parkland, how many bids, whether the 2 bid packages go out, when the bid opening is. I know there's something about when there's a vote on the bid opening, but not anything discussed on any of that. And that's old business. Public records request. I have trouble writing and I don't know who to turn things in. I would like to have a contract, a copy of the contract to review for outside counsel of Flannery and Georgelius. I'd also like to have a copy of the costs to date associated with outside counsel. I wish to have a copy of...
I gotta cut you off, that was 2 minutes. But records requests, you can email in to me, and just like always, and I send them out to legal.
That's unfortunate. So there's no other people, you have 20 minutes and you cut me off at 2 minutes. So that's the transparency of this board. So what about the TV station that contacted me today? Did you give them my name and email?
They made a records request, yes.
Okay, so they reached out.
Public
to me.
records request, right?
Okay.
You know how that works.
I do.
Okay. So regarding the minutes, what I believe we were gonna correct the minutes.
They were as amended, which Alta's online, she's seeing it, so it's as amended. I mean, usually I say the word as amended, but yes, obviously, you asked.
And I didn't hear, and I didn't, I didn't get your name.
Dan.
Hi, Dan.
And then regarding audio, okay, that's up to ADP. If they show up and wanna record, that's fine. We do not require the meetings to be recorded.
So you don't record when they're not here?
No,
Okay. And it was a question, because some do.
yeah, no, we don't.
But there is a great source, the League of Women Voters does a write-up on their website.
Yep. And then
Right.
regarding a bid opening, there's specified dates for that. If you go on the website for GPH, it's clearly listed on there, and it clearly states when the bids will, the closing date, and then, then there'll be a public hearing, a public opening of the bids.
Did the two bids go out, like with the
It's on-
kind of,
It's on the website.
all right. Thank you, President
You're
Perrin.
welcome, Ms. Briggs. Okay, what else? And that's it.
Pretty
right?
much it. I'll get the, and it doesn't have to be in writing. I have trouble writing right now.
No, I mean, you can verbally ask after we're done, I just have to cut you off 2 minutes, otherwise it turns into a.
Thank you,
If
Adam.
we give you more than 2 minutes, then it's not fair to everybody else. If
I
we
agree.
only gave them 2 minutes.
And I know I come off as, but I still care about my county. And thank you.
Yep.
All right, anybody else? Okay, so, the next thing, I guess, is gonna be executive session, so, do we have a motion to adjourn to executive session to discuss matters of personnel and pending litigation with counsel?
So
And
moved.
then, I also would like to invite Brian Costura from, our council to come in to executive session as well.
So moved.
Okay, so do we have a second?
Second.
Okay, this will require a roll call vote. Dr. Rude,
Aye.
Ms. Brakey,
Yes.
Mrs. Roman,
Yes.
Mrs. Jones.
Yes.
And Mr. Moreno, yes, so
And there will be no action taken after the executive session.
you hope not.
There's not, there should.
Executive
It's up to you
sessions
what
in
you
your
want
office.
to do. There shouldn't be anything, there's not even taken afterwards.